Dr. Bayano. Today I'll be addressing vaccine myths. So vaccines, just so everyone has like a basic understanding of them, they are a tool that's used to protect you against disease before you are infected by it. They help your body create antibodies, and this happens naturally when you're exposed to a disease, but it can also happen once you get a vaccine. It contains a weakened form of viruses or bacteria, so it can be any germ, usually a virus or a bacteria. It is a form of the virus that is like weakened, and it doesn't cause the disease itself or increase your risk of complications, but it kind of gives you this boost. So when you do get it, you'll have a more weakened form of it. So vaccines have been around for a long time. The first successful vaccine was back in 1796, and that was against smallpox by someone named Edward Jenner. So these have been around for a very, very long time. So how do they work? A vaccine is a weakened form of a germ, usually a virus or a bacteria. Your body naturally makes antibodies, and with a vaccine, it's like an exposure that your body sees, and that way it's able to form an antibody to the germ through your immune system. Your body will create a memory of the disease, and that's how it will fight it. So your immune system has like several different parts. There's an innate part and an adaptive part. So innate part is like non-specific, it just fights anything that it sees, and then the adaptive part is more specific, and that's when the antibodies come in, and then that will be to a particular disease, and that's why you need a particular vaccine to fight that particular disease. Vaccines also help your body to be able to more quickly fight off the virus or bacteria or whatever germ it is when you are unwell and when you contract the full strength virus or bacteria, like in the community or if you ever exposed to a sick person. So now we want to talk about the different vaccine myths that are out there. One of the most prevalent ones is that vaccines contain harmful ingredients. Sometimes they do contain different ingredients, aluminum, formaldehyde, and thimerosal, that could be toxic to your body at higher levels, but the amounts in vaccines are very low, and these levels are really in small amounts, and you are exposed to them even in regular life. For example, in water that you drink, in seafood, there's thimerosal, which is like a mercury containing compound. Sometimes in paint, carpets, and mouthwash, these particles are present, and it's small enough that it shouldn't really cause a harm to you. Another myth that is prevalent is that it can cause autism or SIDS, which is sudden infant death syndrome. This really is not the case, and most reactions that we do see are fever and sore arms after vaccinations. It's more likely that you would be harmed by the actual disease than you would be by getting a vaccine from that disease. Also, there was a study done that claimed this to be the case. It claimed to link like MMR and autism, but that was retracted due to inaccuracy, and it was not accurate. So that is not the case now, and it does not cause these conditions. And then this is just an image that I pulled up showing what I was talking about earlier, the innate versus adaptive immunity. Innate, these are more non-specific, and then adaptive is more specific and helps you target specific diseases. So for example, when you get a vaccine, your body makes these antibodies to be better able to fight off that specific illness. For myth 3, it's better to have the disease than become immune through vaccines. This is also a common misconception. Many people will die of complications from diseases for which we have vaccinations like flu, COVID. So it's better to get the vaccine so that if you do become infected, you can mount a stronger response more quickly and you won't be as impacted by it. So vaccines, they stimulate your immune system similarly as if you would have got the infection naturally, but it helps prevent the complication. So your body will already have antibodies to the germ, so it will already have a little bit of a response ready in the case that it is needed. So what are the myths related to COVID? There are a few and a lot out there. Some of the myths that are most prevalent is that COVID-19 vaccines were not tested before approval, that you can get COVID from the vaccine, and that you don't need to be vaccinated if you already had COVID. So they have been tested for safety and efficacy. They are safe to be used in people. That was the first thing. And then efficacy, meaning that they actually work and reduce infection. They went through various stages of clinical trials, making sure that they were safe and then making sure that they actually worked and they didn't have any bad side effects. So this was already done. In the US, COVID vaccines do not contain the live virus, so you cannot contract the virus from any US approved COVID vaccine. So the ones that we suggest, you shouldn't be able to get the live virus from. Apart from that, we don't know how long immunity to COVID lasts. So therefore you should get the vaccine even if you did have the illness, because we just don't know how long that protection will last. This is an image of long COVID. It shows for people who are more at risk in that case of if you didn't get the COVID vaccine, when you did have COVID, you had more severe illnesses, like you might have required hospitalization, intubation, like a breathing tube, or people who have underlying health conditions, if you have cancer, diabetes, anything anything like that, you may be more susceptible to experience long-term effects or to be more impacted if you do get COVID. So then these are some of the symptoms that people with long COVID have. It's coughing, loss of smell or taste, which is pretty common, body aches, trouble sleeping, brain fog is also pretty common, and then mood changes or fatigue. And there's no test for it. If you do think you have it, you can talk to your healthcare provider. So what can you do about this? Definitely go and get your COVID booster. The 2024 booster is available. It's new, and everyone over 6 months of age can get it. If you're unvaccinated, you will need 2 doses of the Moderna or 3 doses of the Pfizer. The flu shot is also available, and recommend you get it every flu season, so yearly. RSV is also available. It's one vaccine if you're over 60, and then the pneumonia vaccine as well. You can get it if you're high risk, but all adults should get it over age 65. And then these are the categories that we consider high risk: over 65, pregnant, or with a disease that compromises your immune status, such as HIV, cancer, diabetes. These are the resources that I use. If your body hasn't seen these antigens or virus or germs before, it won't be ready to handle them because antibodies allow you to have a memory. So when it sees it again, then it can attack it.
Just remembering that the COVID and the flu shot are not live vaccines is huge. A lot of people do get really concerned that they're getting the flu and getting COVID and feeling really uneasy about what they're getting injected into their bodies. But these vaccines goes through so many phases and so many clinical trials before it comes to us. So they're really proven. And that's not to say that if you get symptoms from it, those aren't real. Sometimes people do feel some sort of cold-like symptoms, but that's not the actual flu, and it's not actually COVID that you're feeling. It's really your body responding to things. Overall, these are so important at preventing you from getting into serious hospitalizations from flu or COVID or from the other illnesses as well. And pneumonia is another huge one.
There's mild side effects that you might have after the fact, like the sore arm and the cold-like symptoms, which is your immune system actually mounting a response and doing what it's supposed to be doing. Not that you have gotten COVID and not that you have gotten the flu from those vaccines. The reminder that the diseases themselves are quite dangerous without the vaccines.